it's a great pleasure that we're welcoming Dr. Carla Brown now to participate at the Next Generation Innovators. Now, Carla actually used to live fairly nearby Malvern about a year or so ago, and was actually in person at the festival last year. But Carla, you've now moved up to Glasgow. So you're coming probably one of the furthest contributors today. We've got one actually coming a little bit further a bit later that I'll introduce, but at the moment you're the furthest afield. So thank you ever so much for coming to us from Scotland. How is it up there?
It's very cold.
Yeah, I'm sure it is.
No, it's good.
Yeah.
I'm originally from Edinburgh, but I done my PhD in Glasgow. So it's actually amazing to be back here, and I'm working with like people that I done my PhD with. So it's really nice.
Yeah, so it's nice to have gone back. So in fact, what we're going to do this afternoon is just talk a little bit about your career and some of the things you learned along the way, because you've had quite an interesting career, as we'll get into, both being a scientist and an entrepreneur with some of the stuff you've done. And, you know, at the moment, I know extremely busy on a project which is really relevant as well. So we'll come to that as well towards the end. But just to sort of set the scene, I'm really pleased actually that you're a biologist or a microbiologist by training, because we've got a lot of physical science and IT represented here today. And that's partly, I have to say, because my background is also in sort of physical sciences, and it's always hard to know people and attract people from the other sciences. So it's brilliant that you're a biologist. Do you want to say a little bit about that sort of initial degree that you did in microbiology and the sort of stuff you did at school that helped?
Yeah, so I done my undergraduate at Dundee University, and then, as I said, my PhD in Glasgow. And I was really attracted to the field by my biology teacher. She was this amazing ball of energy and just was so passionate about microbiology. And it really opened my eyes to the possibility of the field and how many applications it had, not only health, you know, industry, fabrics, art. There's so much that's done now, and that really, you know, enticed me to do my degree, and then obviously my PhD as well.
Yeah, and I mean, what sort of skills do you think you needed as a biologist then? What helped you get through all of that?
I always say that as a microbiologist, you're almost a psychologist for bacteria. This is my original outlook. You need to understand processes, you need to understand pathways, you need to understand how things link together. So as a scientist, you look at a data set that you might get from one experiment, and you need to try and connect it to other data that you've got from other experiments. It's all about telling a story at the end of the day and understanding how each little piece fits into the story. And yeah, during my PhD, that was my favorite part. Sometimes I'd be doing an experiment on a very specific type of bacteria, and then I'd have a coffee with someone from my floor, and we'd realize, oh my God, we're working on a similar protein or a similar mechanism. Yeah, and it's like putting all the dots together, which I really love.
And I mean, that's a really important aspect of science research, isn't it? It's the collaboration. And they often say it's the sort of water cooler effect, where people get together for their refreshments. Often it's a cup of tea in a UK university and a sort of tea or coffee break, and, you know, interacting in that way. And that's where you have the ideas. Have you got any other sort of specific examples you can think of where you've bumped into a colleague and that's actually had a moment where you've suddenly realized it solved a problem?
Yeah, I mean, during my PhD, I was very lucky in that I got to collaborate with not only scientists within my institution, but also clinical scientists in hospitals. So I was working with this amazing scientist at a children's hospital in Glasgow called Costas, and he was looking at the poo of young Crohn's disease patients, and he was trying to see if his treatments were reducing their symptoms. However, what me and my supervisor did is we took that same poo and started looking at the bacteria in it. And actually through that work, we identified a new antibiotic substance. And it was, you know, if we had never worked together, and I think my boss met him at a conference or something, we would never have found that substance. So I think science is being really open. Good science comes from being really open and actually being receptive to other fields benefiting what you're doing.
I mean, there's a lot now of sort of cross-fertilization between the sciences. So whereas traditionally we think of biology, chemistry, and physics, for example, now we have biophysics and nuclear medicine and all sort of fusion of the different sciences, which obviously is something that's happened to you in your career, because you've kind of, as we'll get to in a minute, but you've kind of fused biology with IT and software development. But actually, without getting into the details of what you're doing, there is a lot of IT in biology, isn't there, now, in terms of data analysis and genetics? I mean, do you find, and did you find when you were doing your biological research that you were doing a lot of computing in some form or another?
Definitely. One part of my project, as I said, was looking for new antibiotics. So for that, I was looking at lots of sequence data. So when you look at sequence data, you look for new patterns, and that's how you identify new substances. And that's, the whole field of bioinformatics. A lot of people in my lab were looking at the 3D structure of proteins, and that is all computing. So, and I would say even as I left, it was, database management, regional databases, they were becoming much more prevalent. So computing is a massive component, definitely.
Yeah. And when you fit, so I think it's worth just saying what a PhD is as well, to some, because some of the students at school may not really understand what a PhD is. So do you want to explain just in general terms what we mean by a PhD?
So a PhD is a doctorate of philosophy. And what that translates to is it's a 4 or 5 year degree where you specialize in one single thing and you form theories. So if you've ever seen the film Theory of Everything, which is, Stephen Hawking, it's like that. You look at a very niche area, collect lots of data to solve a problem, and try and formulate an original theory. And that results in you writing a book to explain those theories to your community.
Exactly. And we call that book a thesis usually. And some people spend a lot of time and overrun writing their theses as well. And then, of course, once you graduate from that sort of secondary degree, that's when you can be called a doctor. It doesn't mean you're a medical doctor. It means you're a doctor of philosophy, that you have a PhD. So that's one career path, isn't it? That, if you're really into science and you feel like you want to do it more academically, what we mean by that is you probably end up perhaps doing research at university at some point. So it's worth clearing that up. Now, after your PhD, you ended up down at Queen Mary University in London, and you were doing a bit of a different project there because it's a bit more interactive. Do you want to explain what you were doing all the way back then?
Yes. At Queen Mary, they have this fantastic science museum called Centre of the Cell. Don't know if anyone's been, it's fabulous. And within that museum is lots of interactive exhibits on different research that's been conducted at the university. So I done a temporary 6-month position there and designed an interactive game on poo, which was called Poo Racer. And the mission of the exhibit was to really remove the stigma around poo. And it was with a team working on bowel cancer. And actually, bowel cancer is one of the biggest killers in terms of cancer in the UK because people are too embarrassed because of their symptoms. So we wanted to get young people engaged with poo, show them it's nothing scary, it's just waste, right? That's what it is, by racing their poo down the gut. And just to say, this wasn't a completely spontaneous random job. During my PhD, I actually had been working with developers and creatives and exploring games and apps for science education.
Yeah, so I mean, that's sort of where you've been heading since, because there's a lot of what you've been doing in science education and gamification and education in that way. But before we get on to that, you actually spent some time in the US as well, didn't you? So you actually moved over to the United States. I think it was the Drexel University College of Medicine. I mean, first of all, what was it like to go and work in another country?
It was really scary. And actually, now that I've had time to reflect, it was a lot scarier than I thought it was at the time. I know that the US is obviously an English-speaking country, but they have such a different culture. And when I got there, I was so focused on my job that I don't think I gave myself enough time to really settle in. So that'd actually be my advice to anyone who ever wants to move. Give yourself time to settle. But it's a very hardworking culture. Everyone is very focused. And really, everyone is very committed to science and innovation. It was very exciting.
And a lot of scientists do look to the US as a future career move because it is generally well funded and it's well respected. So a lot of scientists, certainly I know a number that have moved over to the US to work. So it's a certainly part of a career move that can be built into your plans, isn't it? And the ability to work and travel, if you like, it fits really well with a science or a STEM career.
Definitely. And also just making contacts as well. And even if you don't stay in that country, you've got connections that you can collaborate with and just reach out to have a different perspective on things.
Yeah, absolutely. Now, when you were there, you were doing some research on digital gaming, on the effectiveness, but this was proper research, wasn't it? So it's not, trivial. Do you want to explain a little bit about the sort of the depths you have to go to be able to turn this into a science project?
Yeah. My supervisor at Drexel was Dr. Sandra Hartman, and I actually met her at a games conference in Norway, just spontaneous meeting over coffee. And a bit like me, Sandra is very committed to interactive resources and interactive methodologies for education. She understands that we're moving away from the didactic lecture-based. And she had a vision where she wanted their College of Medicine, which up until then had been doing normal science research, to develop a wing which would be focused on games and app development for use in their courses. So I was there for almost 2 years, and we done extensive amounts of research with students from all over the university to not only develop the games, but test the games. And the gaming research field is still emerging, but it's growing. So there's lots of frameworks and there's lots of methods that you can use, but you need a lot of data. And I think that's where some papers and some studies are limited. You need big populations. Yeah.
So to get representative results and to really understand whether it's statistically correct or not. Yeah. Excellent. And then you came back and worked for Public Health England on another healthcare project, which was Ebug. Yeah. And of course, Public Health England are in the news a lot at the moment. But that kind of led on to what you've been doing now, I think. Is that right? But when you were with Public Health England, you're actually down this end of the country. So what was Ebug?
Yeah, sorry, I'm just seeing my life flash before me.
Yeah, I know. We're just going through it, aren't we?
So Ebug is an amazing project. I just want to say that before I start. So it was started by Clena McNulty in 2000s, and her mission was to educate every child in the UK and Europe on antibiotic resistance. So Ebug is a website, and it has extensive learning materials for schools across the world now. And I was managing that website and that project. And what was really lovely about that position is it almost was the final jigsaw piece that I needed, because now I have the science, the gamification, and now I understand public health and behaviour change. And they were the ingredients for my company.
Yes. And so about 5 years ago, you set up your company called Game Doctor. And do you want to explain what it is?
Yeah. Game Doctor is based in Glasgow, and we develop gamified apps and interventions for use in healthcare and education. So we work with scientists, we work with healthcare professionals, and we develop apps that can be used to change behaviour and just improve knowledge on complex health.
Yeah. So in terms of the company, you're kind of in charge, but you have a team under you that are developing the software. What kind of other functions have you got in the company? I know it's still a relatively small company, but just give us a flavour.
Sure. Right now, I mostly work with contractors and freelancers. So my team consists of 2 developers. So one is Greg. He's amazing. He's from Cheltenham, so that's quite nice, quite cool. And Greg is really fantastic at sort of app development. And then I worked with a developer from Scotland called Anthony Lewis, who used to work at Sega. So that's pretty cool. And then I work with a range of artists and animators. And I now am very tightly collaborated with a health psychologist at Stirling University called Pamela Rackle. So together we're able to develop interventions that are engaging, gorgeous to look at, and have that psychology behavioural change element.
And the sort of the Glasgow, Edinburgh area is actually, there's quite a lot of gaming development going on up there. So is the reason why you're back up there, apart from your past, having been there before, but does that help you with what you're trying to achieve?
Yes. So the Scottish gaming cluster is amazing. There's so much talent. There's so many strange but wonderful things being done with games. And honestly, I couldn't have imagined how much my company was going to grow the way it has this year. Not only because, to be quite honest, not only because I'm back with people who know me and trust me, but also the Scottish government is putting a lot of money into innovation and health. And therefore, the funding around for these projects is just immensely more.
So some people that are maybe thinking about going into the gaming industry might want to look at relocating at some point in their lives to the Edinburgh-Glasgow region and be part of that cluster. So, I mean, right now you've been really busy. Obviously, we're all suffering with the COVID-19 pandemic and working through all of that. But you are actually successful in winning one of the Innovate UK grants, which is a scientific and technology grant to allow you to develop some stuff. And you've been developing a game around the COVID-19 pandemic. So do you want to just explain what that does?
Yes. So we received Innovate UK funding in June, and the mission was to develop an engaging but accessible mobile game that would educate school students and young people on how to protect themselves and others against the virus, how they can prevent the virus from infecting, and also to give them a bit of hope and positivity towards the future. Our game is for Apple and Google Play devices, and we've spent the last 3 months designing it in collaboration with schools from Scotland, from England, from Gloucestershire actually, and with scientists from Glasgow Uni, Queen's Belfast, and our psychologist from Stirling. The whole premise of the game is it's set, you can kind of see in the background actually, it's set in this abstract world which we took a lot of inspiration from the lungs, but we wanted to remove it from health and death and disease. And the player uses different skills and different tools to knock out and defeat the virus. And the tools range from drugs, vaccines, the immune system, hygiene, etc. And the game difficulty is influenced by things going on the outside. So social distancing, face masks, etc. As those reduce, the virus waves and the intensity of the game increases. Wow. So it's what we call a casual game. So you think about Candy Crush, puzzle games, where it can be picked up, played in 5 to 10 minutes and put down again.
And so is it available now for people to download, or is it still being tested?
It's available on our beta testing, which is all over our website and my social media. But we're soft launching the game publicly on October 26th. Okay. But we're doing that through the Times Education Supplement, targeting schools first before we go all the way out to households. Yeah, fantastic. So, I mean, that was, a really quick project, I would imagine, to go from pretty much zero in in June, and ramp that up three and a half months later, wherever we are, to something that's workable and being tested. So, I mean, what about the stress of doing that? So we've actually been making another COVID game at the same time. Right. Do you know what? It has been really intense, and there has been some days where I've had to just take a step back. But this is my vision, this is my mission. And actually, for the first time in a few years, I've been given a platform to really show people what I can do. And I don't want to lose that opportunity. Yeah. So yeah, I'm really proud of what we've done. However, we've got massive vision for the product, and we're working with some different public sector groups to try and get some more funding.
That's fantastic and really exciting. And I think, you know, the message there is that, you know, everybody thinks, oh no, COVID-19 pandemic, jobs being lost. Of course, it's a real problem, but where there are problems, there are opportunities. So, and you seized on an opportunity, you're able to get some funding that would otherwise not be there. And now you're launching something that's got relevance to the problem. So that's really fantastic. And that's kind of innovation. That's sort of adapting to the situation, making the most of it. And that's what we've all got to try and do. So that's really, really good. I've been watching the Q&A. I don't see any questions. I have asked whether anybody has any questions, so I don't know. We'll give it a second to see if anybody else wants to ask a question rather than myself. But it's really good that you're able to join us. Thank you ever so much. I know you're extremely busy. Hang on, because I think people might still ask a question in the chat. So keep an eye on that, and they might be able to do that sort of semi-offline. So thank you ever so much, Carla, for joining us. We'll see you again soon when you're next down in the area, and good luck with getting that properly launched and in the hands of lots and lots of people.
Yeah.
Take care.
Thank you, everyone. Thank you.
Okay, bye-bye.